Okay, so we have our Genotropin 12 that my son gets, and we're going to go ahead and put it into the Genotropin 12 So what we've done is we have the injector, and we have some alcohol wipes and some needles, and we're just going to open this up now. What I like to do with this is I like to keep this warm. So I'm warming this up in my hand while I'm doing the rest of the stuff. Now I'm going to get my needle ready. We're going to take out the old cartridge, so we're going to unscrew this. And we're going to remove this, and we're just going to put it aside. Now the next thing we need to do is this little plunger is all the way up, so we're going to have to lower that down. So what we're going to do is we're going to hit the little red button here, and then we're going to just unscrew this thing until it goes all the way down until you can't unscrew it anymore. Keep going, we're unscrewing, and eventually it's going to stop. All right, stop. I can't unscrew it anymore. So now what we need to do, I'm still warming this up because I want it to dissolve better, but it's pretty warm now. So I'm going to take this and I'm going to put this inside the top. Now I'm just going to put this in here. I'm just going to gently screw it in until I get any resistance, and I'm going to stop. Now, we're going to have to clean this off a little bit. We don't want any contamination. So what we have in here is air, we have the dried growth hormone, and we've got liquid in there. And they're all going to mix, but there's going to be air in there. So we have to get the air out. We do that by having a needle in there. So we're going to screw this needle in. Take it off and take it off. We're not going to use this needle. We're just going to use it to get as a vent. Now, what we're going to do, we're going to start to screw this in. And we're going to try to hold it upright. We're going to go very gently. We're going to just keep turning it. And you're going to see, you can see right there the white powder still there. We're going to screw the fluid in, and there it goes. The fluid just hit it. It's starting to dissolve. So we're going to keep going. We're going to keep screwing this in all the way. This is calibrated, so this is all you need to do. Okay, now, here we are. Now what we're going to do is we're going to look up towards the light. We're going to sort of gently move this. And you can see that everything is pretty much dissolved. That's pretty much the way it works, particularly if you warm it up. Okay? There's a little bit of air in the top. Don't tap this a lot because you'll make more bubbles, and you don't need to do that. We're just going to gently tap it. There's a bubble at the top. Now what are we going to do? Well, we're going to take this thing right here, and we're going to move it right to there. See that little white line on the slot? And all we're going to do is we're going to go ahead, and we're going to see a little bubble stuff come out, maybe a little other stuff, and we're going to push it all the way in until it stops. That's all you need to do. You are done now. Do not mess with this. Do not care about air bubbles. It doesn't matter. You are done. So what we're going to do now, because we might have contaminated that needle, we're going to put the cap back on. We're going to, so the cap will unscrew this way, but that will also, we'll unscrew the cap the other way, this way. That will also unscrew this. So you have to hold this right there with your thumb so this metal part doesn't move. And then we're just going to unscrew this and remove it. Sometimes you have to squeeze it to get this needle off. It's done. Now what are we going to do? We're ready for an injection. So what we're going to do is we're going to clean this off again, get it nice and clean with an alcohol wipe. We're going to get a fresh needle. We're going to put this in here and screw it in good. Take the top off. And we're going to get ready for our injection. In this particular one, we have a 2 milligram dose. So we're going to take that little red button. We're going to hit it. It clicks. We're going to turn this until we get to the 2. and we'll remove this, sterilize the skin, and make the injection, and we're ready to go. Cool. So now we're coming down to the last shot here. So we're going to go ahead and do our normal routine. We're going to clean it off. We're going to get our needle out. We're going to screw this needle on. We're going to click the red button and turn this until it shows our dose. Very important. We may go too far. Can't turn it anymore. You have to turn the last dose back until this white line aligns with that line, so that when we push it in, it will actually go in. And that's the secret and the idiosyncrasy of the last dose on this particular Genotropin injector, okay?